Hello friends, quite often we get patients who complain of this kind of lesions on their face and they want to get them out just because they are unesthetic. I am Dr. Arun Panda. I am a head and neck and facial plastic surgeon and I practice in Mumbai. So what this kind of lesions are, they are basically known as moles. We are all aware of it. In a medical terminology, it is known as melanocytic nevi. So these are nothing but clusters of cells which cause pigments on our skin. They are called melanocytes. So melanocytes are the cells which produce melanin, the pigments which gives us the color on the skin. So when this cluster together, they form something called as a mole. Most of the times they are not dangerous and they are benign lesions. But we need to understand that sometimes this can go into a malignant transformation also. So they could, be cancerous. So although patients come and ask us that is it cancerous, but most of the times they are not and they are just benign. But we need to rule that out. And how do we rule it out is basically once we excise it, we send it for a test or a biopsy. A histopathology would reveal if it's a benign or a malignant condition. Nothing to worry about. If you find a mole which is flat or slightly raised above the skin and it is like a circular lesion and which has actually not changed its shape over a period of time, you don't have to worry much about it. But then you got to notice something which can cause a little alarm on your mind. So we call it as a B, C, D, E. That rules out that this could be a malignant condition. A is basically nothing but asymmetry. Asymmetry means if half of the mole is not very symmetrical to the other side of the mole. B is basically the borders. What I am trying to say is this borders of the mole should not be very ragged or ununiform. This should be a uniform border. The third one is the color. The color should be very uniform. They should not be ununiform. That means that half should not be black and half blue or something like that. So if you see, they are all of uniform colors. So they can be black, they can be brown or whatever it is. And then C, as I mentioned, is the color, and the D is the diameter. There should not be change in the dimensions of the particular lesion over a period of time. If you think there is a change in the lesion, a change in the dimensions of the lesion which is happening over a period of time, that should kind of cause a little alarm on your face, alarm on your mind. And the E is basically evolving. What evolving means is basically it should not, the lesion which is there on this particular thing, it should not keep on changing its size, it should not keep changing its color, and it should not keep changing its structure and things like that. So you should notice all this A, B, C, D, E, and if they are not falling into one of these categories, you should be comfortable that it's a benign lesion. So patients come to us and they ask for getting that out just because it is unesthetic. Now how do we take it out? Is basically there are two ways of taking it out. Either we can do surgical excision, is like when we excise this around and then we suture it, we stitch it together and close the skin there. The problem is we might be leaving behind a little bit of a scar in that condition. The second thing is something called as a surgical scraping. Surgical scraping can be done by a blade, by a RF cautery, radio frequency cautery, or lasers. So I personally feel a RF cautery or a laser is much better when we are doing a surgical scraping. There is a video which I am going to show there now, which shows how we are using a radio frequency cautery to surgically scrape out mole for this particular patient. So he complains of multiple moles on his face. So this video demonstrates how we do radio frequency cauterization of the mole. For patients who want to get rid of them, I would suggest please do not try to excise this at home, because there are chances that you might cause infections once you are excising, because we use sterile conditions, sterile instruments. The second thing is basically you wouldn't possibly know that if it is cancerous or benign. That's one important thing which we should not be missing out on. So the third and very important thing is there is a good chance that we might leave behind a scar when we are excising it, if we have gone and over excited a level of excising the tissues. So doing at home could leave behind a scar. So I would suggest please visit your surgeon and get it out, and please feel free to let us know if you have any queries, and please watch this video how we excise moles. Thank you for watching. Please do like and subscribe to our channel. Thank you. This is Dr. Arun Panda, facial plastic surgeon, Mumbai.